Hello, everyone. It's Thursday, May the 28th. I know a lot of us feel this way, but, as you grow older, time just seems to get away from all of us. But I can tell you that I'll be really glad when May is over. It seems like that the last few months have been really, really, really slow on, I'm sure, an awful lot of us. And where normally time just flies, the last few months have been anything but that. There's no question it's been hard, and there's no question it's been stressful and all those things. But the biggest and most important thing of all is just the sorrow that this has been on 74 families and all the loved ones of those in West Virginia, plus the incredible inconvenience that it's been for lots and lots and lots of us, if not all of us. But it's just been a time in our lives where no one has ever been through anything like this. The balancing act is really tough, and the rewards have been unbelievable from the standpoint of just seeing how great West Virginia you've done, and I'm really, really proud in every way of all West Virginians and all that you've been able to accomplish. But it's been a long, long road. Very, very, very happily, I say today we do not have a death to announce. So that's great. That's just plain great. And let's just hope and pray that we can keep that going and everything. This is week 5 of our West Virginia Strong. It's hard to believe that it's week 5 from the standpoint that it seems like that has gone pretty quickly on our comeback reopening plan. Another round of reopenings will begin on Saturday, May the 30th. Week 6 will begin on Monday, June the 1st. And all the guidelines and everything for the businesses are up on my website. And we welcome you to go to them nonstop. There are still questions that have to be answered in regard to youth summer activities, Little League or soccer and all that. We have postponed as long as I think we can and everything. And today, we're meeting later today to have further discussions on that, and we should have you more guidelines and more answers on tomorrow. And there's other things that we have, and that we've not purposely. There was some concern about indoor tennis. Just things that you would think, well, gosh, if we're able to go to a bowling alley or go to a swimming pool, surely to goodness we can play tennis and everything. But there was always concern about, one person serving with, a tennis ball and getting over to the other person, they're serving with a tennis ball and touching the same equipment and all that kind of stuff. But now we've learned a whole lot that basically the transmission is more just human to human and less in that type of transmission. So, we're going to have some more guidelines on a bunch more stuff maybe tomorrow, and we'll be able to share that all with you tomorrow. The biggest thing I guess I've got to report on today is Huttonsville. We now have a total confirmed positive of 105 inmates. Yesterday, when I came to you yesterday morning, we had and Jordan, I hate to jump around, but let's go to the graph of daily percent of positive cases. Just if we could go just there for just 1 second. On the second graph, you see that big spike, and I talked about this yesterday and everything, and that big spike is exactly what we've been looking for to know where to run to the fire. Well, that big spike was led from Huttonsville. Now, the spike actually went even a little higher. Yesterday when I was able to talk with you, and it was, I don't know, 10:30 or 11 o'clock in the morning, that spike was at like 6.9 or whatever, and now, after we got all the stuff in yesterday, the spike really was at 7.05. And so you can see exactly what's happened. You can see the math, you can see the science, and that's led us to run to that fire. So later on today, Secretary Sandy, is our secretary. It was of DMAPS, and now it's the new secretary of the West Virginia Department of Homeland Security. Probably a little easier to tell you the truth, and he's going to be joining us today, and he'll shed some additional light on that. And the other thing is just this: everyone needs to understand that testing has been a problem. From the standpoint of, can we just, in the beginning, I told you before, in the beginning, to have a test kit was a big deal, and we only had like 100, and we were just absolutely just trying to test the sickest. And thank goodness it went a long time before we even had a positive, So now that testing has expanded very, very significantly, but we had to really watch what our capabilities were. We couldn't run out and test everybody in West Virginia on one day and everything. But now, as that's, and we had to somewhat prioritize from the standpoint of not who was the most important, but who had the biggest issues that were going on at the time. The nursing homes, we know, were a real big-time issue situation, and that's why we ran to that fire and tested everyone. Right behind it, we all know the elderly is a big-time problem. And over and over and over, we kept testing those in our jail facilities that had any symptoms whatsoever, and we were pitching a perfect game. I mean, we didn't have any positives and everything else. And so we were continuing to monitor and pass out our testing as we thought it was the best to test here and there, because we didn't have enough to go around everywhere. Well, now all of a sudden we've had an outbreak in one of the prisons and everything, and so what do? We do exactly what we should do, and that is run to that fire. And we have enough testing capability. We're going to test everybody in our prison facilities and everything. I think we've got a total inmate population in West Virginia of about 14,000. It'll be a little bit easier than testing all the nursing homes, and so we do have the capability, and we're running to that fire, and we're going to take care of it. Now, as far as the free testing that's going on, and it's going on in the counties of Berkeley, Jefferson, Kanawha, Mineral, and Morgan County, and I don't have exactly, somebody help me just a second here, is that going on today?
So the testing today is in Fayette County. The testing begins tomorrow through Saturday.
Oh, I've got it. I'm sorry. I'm sorry. I've got it. It's right in front of me. Today we're in Fayette County. I'm sorry. And Friday and Saturday we're in Berkeley, Jefferson, Kanawha, Mineral, and Morgan counties. And I think the times on that were like 9 a.m. to 4. Is that correct? Well, I got it right in front of me over here now. So it's 9 a.m. to 4. And so there's going to be, in addition to this, we're going to announce some expanded testing out in the communities that are close to this, the correctional facility at Huttonsville. And we're going to announce that, and that'll be announced over the weekend, to where we'll do some expanded testing in the community and everything, just offering to anybody and everybody in the community to come and take advantage of this free testing, and just to double, triple sure that we don't have a situation where we're leaking out in the community and having additional positives out in the community. Today is a great day from a lot of different standpoints. First and foremost, it looks like we're getting this situation under control at the prison. Now, I have said so many times, we know there's going to be additional stormy seas, and we know that this situation could turn right around and bite us, and we're trying to stay on top of it right now. Right now, it looks like we're doing pretty good as far as that facility, and we're trying like crazy to stay right on top of that. And but today we have no deaths, which is great. In addition to that, you know, we have our testing going on. We hope we're ahead of the game on Huttonsville. The only other things that I have to report on are just this: is from the standpoint of our cities and our counties, we continue to encourage you to apply. We've received 8 completed applications. We need to receive hundreds. We've received 8 completed applications at this point in time, you know, and we need to receive a whole bunch more. We got one in, I think, yesterday on Berkeley County and everything. It was a large one. It was great and everything. Everybody's working it, you know, and to make sure that it falls into all the guidelines and everything, and it fits, you know, and I'm sure they're going back and forth with the Berkeley County people and everything, you know, to make sure that we abide by the laws and the guidelines that we have and everything, and as soon as we settle on that, we'll get those dollars out immediately. And the only other thing that I've got is to remind you about the census, and then I'm going to go to that. But the census is something that please, if someone would just remember to take the lead in your communities, or take the lead on your street, and call your neighbors and urge them to please be counted. We need them to be counted really, really badly. And if y'all bring me that'd be really good, and I'll read this to you. This just came out from President Trump. He just tweeted out that the men and women of the National Guard have been doing a great job fighting the coronavirus. This week, I will extend their Title 32 orders through mid-August so they can continue to help states succeed in the response and recovery efforts. And that just came out from our president and everything. And that basically was what, you know, that I came out, you know, just probably, I don't know, a week ago. Surely had some conversations with the White House and said, look, we can't run, you know, up to the 89th day and then say we're not going to continue on with honoring all the benefits and all the great things that the National Guard's done. There's no way in the world our president's going to, you know, fall into that scenario. He's done a fabulous job in every way, and I love him to death. And so I'm tickled to death that, you know, he listened to a lot of people, including his little buddy here in West Virginia, and so we got that extension till mid-August, and that's really good. And basically, what this does is it rewards the National Guard, the members of the National Guard, you know, with lots of extra benefits and things that they deserve. I mean, I don't know how to say it any better. They deserve it tenfold in my book, and I'm sure the president feels the same way. And we may have just had some bureaucrats running a little afoul. And you know, you heard me probably, like I said, about a week ago. I was. You know, I wasn't happy about that, and so I'm really tickled to see that just came through. So that's hot off the wire. But anyway, thank you all so much. I don't really have anything. Well, I do want to pull up these graphs real quick 1 second, Jordan. And you know, our recovered recovered cases and active cases, you know, this is kind of neat. You know, from yesterday our recovered cases were 1,207. Today, if I'm reading this correctly, they're 1,211. But our active cases have now dropped from 646 down to 621. And if you'll see that little dip down in that bottom line, my gosh, that's exactly what we want to have happen right there. So we'll take the little dip down. We'll surely take no deaths today. will surely take what our president's done, and we're going to be happy and celebrate May 28th, and hope and pray we can keep it going.
All right, thank you, Governor. First, let's go to Jeff Sandy, the Secretary of the West Virginia Department of Homeland Security.
Well, without question, today is a special day in the history of our state. In 1989, the super secretaries were formed, and as a result, the West Virginia Department of Military Affairs and Public Safety was formed and stayed the same for basically 30 years. Over the years, the West Virginia National Guard has become such an important part of our state and what they have done during times of flood and other disasters, and what they have done as leaders in our country. And the example that I like to give is when I was in Iraq, and when I was in Iraq working as a federal agent, and they said, "Where are you from?" And I said, "West Virginia." They complimented the West Virginia National Guard. So they're known all over the world. So today at 12:01 a.m., the DSM is no longer. And what we are now is the Department of Homeland Security, and the West Virginia National Guard reports directly to the governor's office. And that's basically what has transpired since Governor Justice has been in office, because he knew of their abilities and his faith in General Hoyer. So we named it the Department of Homeland Security to match our federal partners, and the remaining agencies within the Homeland Security deal with our safety and security of our citizens, from our jails to our fire marshal's office, state police, and the new Division of Emergency Management, which was previously the Department of Homeland Security and Emergency Management. So today is a big day in that regard, and I feel that it is an outstanding decision that was made by the governor and supported by a vast majority of all of our legislators during our last legislative session. So we anticipate big things, and the bar has been raised very high, and we will proceed with that. The next thing that I wanted to talk about is the marching orders from the governor. The governor has stated that he wants all corrections tested, and until the late hours last night, we have been working with DHHR, our healthcare providers, local health departments in the West Virginia National Guard to accomplish that. As of today, the total number of inmates and employees and contractors that work in our facility is 13,966, and we are preparing to do the testing on those. In addition, though, I wanted to let the public know how an inmate, when they are brought into our facilities across the state, I feel it's important that the public knows. When one of our police officers, state troopers, etc., bring in an inmate, they are processed. And during that process, there is a medical questionnaire. And they're asked, do you have illnesses, what they are, etc. The second step is that they are taken to a body scanner. And the governor, through the opiate settlements, every one of our facilities have a body scanners. And this is not only for the safety of that individual, but for the safety of the other inmates. In the amount of drugs and other items that have been packaged in an individual's body through digestion or one of their body cavities has been tremendous. So successful that we have to have employees go to the parking lot and to locate drugs that were dropped when they realized that they were going to be scanned coming into our facility. Now, part of the coronavirus protocol, it's important to know that every new inmate that comes in is placed in an individual location whereby for 14 days they're observed by the medical providers at each of our facilities. Their temperature is tested. If they have a fever, they are taken to a hospital, and we have transportation units that do that. After the 14 days, that individual is then taken into the general population. Now, even after that is done, the general population is tested by their temperature daily. That inmate, as the commissioner stated yesterday, is given 2 masks, and our corrections employees are given 2 masks when they're inside the facility. So we follow, as the commissioner stated yesterday, we follow the CDC guidelines for correctional institutions. And as another question that was asked yesterday was the tracing, and that is being done at the Huttonsville area by the local health department, and we are in communication with them. So last thing I wanted to mention to you, the general did a great job yesterday discussing what correctional industries is doing in our war against the coronavirus. And I'm happy to announce that yesterday, our St. Mary's Correctional Facility is now up and operational with equipment provided by the National Guard providing PPE. So thank you, and thanks to all the citizens and the great job they're doing.
All right, thank you, Secretary. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. Today is a very good day from the outline that the governor gave, and certainly with the president's very wise decision to continue funding for the National Guard. That really is one of our state treasures, and being in this position to help with the COVID pandemic, I've really been able to see that, and we owe a great amount to the Guard for many, many reasons, and the Guard does great work for West Virginia every day. Our R0 level is still about 1. We know that the biggest outbreak that we have is in Huttonsville, and the governor has gone over that spike. We also know that there is some activity in some of the areas that we have anticipated would be involved in the Eastern Panhandle, and certainly, you know, as we are opening again, we are watching very closely those areas. We're certainly watching areas with our most vulnerable population, our African American population, and others, and also we're keeping a close eye on areas that have opened up as part of the tourist attraction set for the state of West Virginia, particularly given the Memorial Day holiday, where lots of people happily came to West Virginia to experience the beauty that we know every day. So with that, we're keeping a close eye on things. So far, our numbers have not been changing dramatically at the community level, which is really fantastic. And as we work with our great county health officers and local health departments, and with great folks at DHHR and the Bureau of Public Health, we feel that West Virginia is still doing well as we continue to open. But we also want to reinforce every time that we address the good people of West Virginia that the virus is still out there. We've still had a very few number of people test positive, and that we know that we still have the most vulnerable population in the country. So don't let your guard down. Continue to distance. If you're outside, stay 6 feet away. If you go inside, please wear your face covering or mask, which protects the people in that environment. And if you're sick, stay inside. If you can stay home or work from home, please do that as much as possible. Keep your hands clean, avoid your mouth and your face. And if you have to sneeze or cough, please cover that. So we know by doing these things, by changing our behaviors, not just finding a vaccine, we can protect each other, protect ourselves, and protect West Virginia, and demonstrate to the country what an incredible place that we all live in. So thank you very much.
All right, thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. I will give a brief report here on our some of our testing. The results are in for last weekend. We have a couple of tests that are not back, but the first two are totaled. We have 3,058 individuals tested last Friday and Saturday at Cabell County, Kanawha County, Marion County, and Monongalia County. Of those 3,058, we're pleased to announce that we had only 6 positives. We had 1 African American positive. The percentage of African Americans in Cabell County was 56% tested out of 651. In Kanawha County, we had 21% of the tests were of African Americans. Preliminary data, we have a few again outstanding or pending. Marion County, we had 47.9 or 48% of those tested were African American. And in Monongalia County, we had 8% of the individuals tested were African American. We had 5% that were Asian. So we appreciate the efforts from our local health departments throughout these areas. Also, the African American Minorities Task Force, their assistance in selecting sites, and of course the National Guard to assist in the testing. So, thank you.
And I understand there were some questions yesterday about contact tracing in Huttonsville and the understanding of what happens in an outbreak investigation. So just very briefly, with an outbreak investigation, you tend to, of course, before the outbreak, you're putting in place all the prevention measures that you can to minimize risk. And then when there are identified cases in an outbreak that occurs, you have 3 different components to that response. There is the case investigation, understanding what happened and when they might have been infectious to spread it further, the contact tracing, and then finally the prevention measures that you make sure, the control measures that you put in place at the time. So you can imagine that at Huttonsville, it has been a busy time. The local health department is working actively doing those contact tracing and case investigations with the staff that were involved, and so they do those investigations. We're also partnering with corrections to do the case investigations and the tracing in the facility. So all of those involve a one-on-one interview with each individual who's positive. You understand the disease and the symptoms they may have had when they may have been infectious. You look to understand where they might have been exposed, how they might have gotten the disease. And then the third area you look at is who they might have exposed. So we have questions around what's their job in the facility? Who are their cellmates? What have they had visits face-to-face with attorneys or court visits? Anything that understands movement and potential connections between people. And so we look at that to see who might be the contacts, and then follow up with those contacts to assure that we monitor them for symptoms and to manage appropriately so there's not further exposure should they get sick. And so that's the brief version of how that happens, and we really appreciate the incredible partnership of local health department and their incredible work there and their leadership in this arena, and all our partners at Corrections and the National Guard that are helping to do the same. It's a big task, and we are enjoying doing that together.
Let me add one point here to the testing data I neglected to mention. We're looking at providing that information once it's final on the website. So those individuals who might have more interest in these numbers will be able to see all of those as soon as we test those here, as soon as we place those on the website within the next few days, we hope. Thank you.
And this afternoon, actually, I believe the testing in Fayette County is at the Oak Hill School Complex from 2 to 6. That's available to communities there.
All right, thank you both. Major General Hoyer with the West Virginia National Guard is also joining us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner today is Katie Coyne with the Charleston Gazette-Mail.
Can you hear me?
Yes, we can.
All right, this is Katie Coyne with the Gazette-Mail. Governor, you pledged yesterday and today that there would be mass testing at corrections facilities, but there haven't been really any details on when or how that will happen. What is the timetable for this? What will that testing look like? And if the details haven't been worked out for that yet, why is that?
Okay, Katie, the first and foremost, you got to remember now, we had this outbreak about, well, first of all, we had the positives about a week ago, and then we did very prudently, what we did is we tested a block, and then we had more positives, and then at that point in time, what I did was I said, test the whole prison. And I can't recall exactly the day that was, but I don't know if it was Friday or Monday or whatever like that. And then from that, now what we've expanded to yesterday is test every facility in the state. So we've gone in a week from no cases to testing a block, to testing the entire Huttonsville prison, to testing every facility in the whole state. Now, and we do have a real plan for that. And, you know, I think probably it would be better for our medical community to talk about that. And I think, you know, all of them could weigh in, but everybody's moving, and everybody's moving very, very quickly. We do have the testing capabilities, and we will move, and we will move very, very expediently, just like we have over and over and over. So, you know, I don't really, you know, I surely want everyone to know it wasn't like we were just not testing anyone whatsoever, you know, in our jail community. We were testing those that showed symptoms of any kind of level of sickness, and we had zero people that were, you know, that we had found with any kind of level of positive. So you know, maybe at this time, you know, our different people could weigh in, but it took us 2 weeks to do all of our nursing home community, and it's almost, it really is almost twice the number of people. I'm sorry, it's half the number of people, you know, in our correctional facilities as not you know, the nursing home residents, but the total nursing home community, if I remember, exceeded 25,000. And we've got, you know, and that was staff and everybody, and we've got 14,000 here to deal with. Maybe anybody wants to jump in, just jump in.
Maybe I could start, Governor, if that's okay. So as we are looking at this population, and we know these congregate settings are really a risk for rapid spread, and certainly in collaboration with Secretary Sandy and all of the folks that work at the local health departments, our thought is the following: that the prison system has worked well with having the capacity to be able to quarantine people coming in, and in areas that have stable prison populations and still the ability to quarantine, that we would commit to continuing that, to testing the people who work in these facilities that come back and forth from communities. And because of the testing issues the governor has talked about, to prioritize the prisons in areas with higher endemic activity. Of course, if we get positives, we would then continue our testing. As we go forward, we still want to make sure that people coming in or out of the prisons, or prisons that lack the ability to do the quarantining, or prisons that see a lot of movement, particularly with the courts back in action, are prioritized to be tested first, and working with the medical provider community for the prison systems, that we would then try to coordinate that testing in that way. So we are committed to carrying out the governor's guidance, and he has done incredibly well with his guidance to date. And we want to make sure we are prioritizing appropriately the tests that we have available, and prioritize those for the people that come in and out of communities and work there, which also gives us a biopsy in many ways of those communities to look for additional immediate testing in prisons that have anybody who's positive, continue to do the quarantining, and start to march through with Commissioner or with Secretary Sandy and with the health oversight folks in the prisons to start to intentionally test the prison population, so that we can make sure that we are identifying cases that could lead to rapid spread.
All right, thank you, Katie. Next, we'll go to Steve Adams with Ogden Newspapers.
Yes, Steve Adams with Ogden Newspapers here. I got told yesterday, and I'm curious to know if it's true, and if it is true, what their role is going to be and what they're going to be doing. I understand the Bailey and Glasser law firm has been secured to help the state out with the CARES Act funding. I don't know if that means the grants to cities and counties or what have you, but I'm just trying to determine if that is in fact true and what exactly Bailey and Glasser, what their responsibilities will be in that regards. Thank you.
Okay, Stephen, I can take this, guys. Yes, they have been contacted. They are working with us and everything. They're doing great work and everything. We've also reached out to BDO. They're working with us as well. There's so many possibilities here, and like I said, we want to cover every base. We want to make sure that we're able to get every single dollar that we can possibly get into our state and leave no stone unturned. Unturned. Now, from that, BDO has been able to bring us the opportunities, from the standpoint of grants that we may have missed. Bailey and Glasser, if I'm correct in that name, is doing a lot of great work and following up on stuff. We've got our people, all of our people in the Department of Revenue that are working this, and the governor's office. Everybody's working it in every way. I'm working it from the standpoint of, the federal government. And Stephen, what we're trying to do is one thing, and that is make sure that we get every single dollar that is entitled for us to be able to get to our West Virginia businesses, to our West Virginia individuals, and in every way, and we're doing it. We're doing it. So absolutely, we in this one, we've called on all the King's horses and all the King's men to be able to do the job for West Virginia that we really need to be able to do.
All right, thank you, Steve. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I know you're going to talk about summer activities and things tomorrow, but what kinds of things are you going to take into consideration as far as reopening summer youth camps and sports? And with numbers low and the average age of those who've passed away being roughly 77, do you see more flexibility to open camps that parents rely on during the summer?
Okay, Amanda, I guess I better go with that too, but we really want to be able to address first and foremost the guidelines that the SSAC has come out with. We're going to do that today. I think, they are doing a marvelous job. Like I said, whether it be, Bernie Dolan or Greg Reed or all those that are really there and, that have done great work for a long time there. And so we need to get through those guidelines. We need to get through, some more, further discussion, and possibilities of little leagues or summer soccer, from the standpoint of summer camps and youth camps and everything else like that. That becomes a little more problematic and everything, but we're still working through it and everything. And just from the standpoint that, we've got to be able to keep our kids really safe. And of us all, it's a terrible, terrible problem when somebody, an elderly person, gets this terrible disease. And from the standpoint, the kids can be, transmitting it back and forth and everything to our elderly community and all that. And we're concerned about that. But for crying out loud, we really, really need to watch our kids. And, there's I don't even know exactly the name of that disease, that was a spinoff of this coronavirus in New York where they had 100+ kids that got really, really bad sick. And so there's, there's issues that we're trying to work through.
All right, thank you, Amanda. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hello, Governor. Hello, everyone. My question is about the state's latest numbers. I understand, based on some data that I'm seeing, that over the past 14 days, the average of increase in cases has gone up about 130%, which puts West Virginia at the top of an increase in cases around the country. I'm curious if the state has any plans to slow down the reopening process, and if so, what a threshold would need to be to stop or slow the reopening plan. Thank you.
Well, let me start off, and then I'm going to defer to you know, to Dr. Marsh or Dr. Slimp, but, you know, or Secretary Crouch, but I think that the issue primarily is Huttonsville right now, you know, and the expanded testing all throughout that jail facility and you know, maybe the expanded testing throughout our minority communities and everything, the very drastic expanded testing that we're doing. As far as community spread and everything, they can speak about that, but for what I know, I think the issue is not West Virginia. The issue today is Huttonsville. But anyway, if you guys could jump in and speak about that.
Maybe I'll start, and then Kathy, maybe you can follow if that's okay. So Dave, thanks for the question. You know, that is certainly something that we are watching very carefully. And we know that as we reopen and people come back together, that the virus will have an opportunity to spread more quickly. And as we look at our expanded testing in many communities as part of our commitment to our vulnerable African American community and starting to biopsy places in West Virginia where we see more activity or anticipate seeing more activity, we have definitely identified more people that are COVID positive, but at a percent of positivity, we are still at the community level in that sort of 2% or so range. And as we look at these blips, and the governor is, I think, correct that we see a congregate outbreak like in Huttonsville in the prison, these outbreaks really make the numbers go very high. And in Randolph County, for instance, the R0 level over the last couple of weeks has risen to over 3 because of that particular congregate outbreak that we had. So as we look at whether or not that we would recommend to the governor's office to consider, the governor to consider starting to, as we've talked about this dance about going back or stopping or slowing up, a lot of that is really related to what we're seeing in the community driven parts of the counties, and then to look not only at the total number, but really that rate of positivity, and also keep an eye on that R0 level, which we're doing now at the state level, and we're developing the ability to do that at the county level. We can do that now. And also the idea of looking at what our hospital capacity is. That's the thing that we're really worried about as well, is overwhelming that capacity, particularly acute bed, hospital capacity, ICU capacity, ventilator capacity, and we have seen no real movement on that. So we know that we have really sufficient reserve that way. So we're watching all that closely. But as you said, you know, as we see more opening, and do more testing, we are going to see more positive cases, and that is worthy of keeping a close eye on. So Kathy, I would defer anything else that you would have to add. Thanks.
Sure. I do think when you see these sudden spikes, it's typically one of two things. It is an outbreak, a large outbreak. That's what we're seeing with Huttonsville. And then the other one is you can often see it if we've got a large-scale testing event. So we also saw an increase fairly rapidly with the testing events in the Berkeley and Jefferson area. So you do kind of look at those, but you also look and see which of those have more incidents of community spread or more likelihood of community spread. So that can certainly be the community-based testing, gives us a better sense of what's happening in the community, as Dr. Marsh has mentioned. And then with our outbreaks, you look at them, some are very contained in a facility, and some there's much more fluidity. And they have the individuals, the cases involved in an outbreak will have more impact for potential in the community. And so I do think that as we look at this stage in our opening, we are looking much more at county and regional levels. And we are, as we've talked about, primarily seeing that those increases or those high levels are in that Eastern Panhandle area, even more broadly than just Jefferson and Berkeley. So that's the area that I think we're watching most closely and want to make sure that we look both at the disease incidence, as well as the healthcare system capacity, as well as the capacity for testing and for contact tracing. Because all of those give us a little bit of sense of what's that wiggle room that we have to move forward. and they have to weigh that with the impacts in terms of economics and in terms of social impacts of our control measures. So it's complex, but it's really an important balance to help to have communities strike what's the right movement forward.
Let me jump in. I want to just say one other thing real quick, and that's just this. As far as Huttonsville, you know, we've been through that, and I think it was Dave. Is that correct, Jordan? Okay. And as far as Huttonsville, we've been through that. As far as, you know, our hospital capacities and everything, we've been through that. As far as our PPE, we've been through that. You know, but we all should understand just this. We did expanded testing in Jefferson and Berkeley County, and we had numbers jump up, positives jumped up, and those positives I think were 15 one day, 20 the next, or something like that. But when you really drilled down and you looked at it, we tested over 800 people both days. So the amount of total, you know, positives per test taken were still less than 2%. They were like 1.7 or something percent and everything. So from the standpoint of the community and everything, still good to go, you know, but from the standpoint of watching, that's what we all want to do. That's why your question is so good. You know, the science of watching that spike at Huttonsville, we're right on top. You know, from the standpoint of watching Berkeley and Jefferson County from their exposure to DC, we got to always be concerned. You know, so it's a great question. You know, sometimes the numbers can lead us a little bit awry, and we've got to bear down and drill down and everything, like Dr. Slimp was saying. And so, and then we get real live numbers and everything. But you can bet everybody here's watching. Everybody here's on high alert all the time.
All right, thanks, Dave. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question possibly for Dr. Marsh, and maybe Governor Justice would want to weigh in. I read something last night that said new research is showing that up to 80% of COVID-19 cases may be asymptomatic. I know we've had numbers before that weren't quite that high, but now it looks like that it's possible that 8 out of 10 people who have it would have no idea they have it and show no signs. Dr. Marsh, how would that change what we're doing defensively in testing as far as checking temperatures, which we've done as a practice at many places, including correctional facilities here at the state capitol? If there are no symptoms and temperature testing on 80% of the people is not effective, and they're also showing no other signs, how exactly can we defend ourselves with security and with confidence that we're catching these things without doing actual tests? It seems like it's a very difficult thing to pull off.
Governor, you want to start? Do you want me to take it?
No, please go, Clay.
Okay. So, Kenny, thank you. I feel like that you've just served me a fastball right down the middle. So I think as we look at our strategies, and you're right, you know, it's very difficult to identify people who have the COVID infection, particularly in the pre-symptomatic phase, a half a day to 2.5 days before having symptoms. And this idea about asymptomatic, I think there's a lot of dispute in the literature whether people have minimal symptoms and kind of brush them off, or they have no symptoms. But we know the spread is oftentimes done by people who are not diagnosed, who have very minimal or no symptoms, or are before symptoms that can actively spread. And understanding and predicting those people is very difficult. And we know these tests that we do, even if we said we're going to test everybody, that test is good in that moment you test, but then a week afterwards, you could have gotten the COVID infection. And so it's very difficult to keep track with our current technologies, even if you commit to testing everybody. That is the reason why the mitigation measures, the behavioral changes, the adaptations that people in the state have taken, which now should include wearing face covers or masks, is so important. Because basically you can't tell who is infected, and you don't even know all the time if you're infected. And because of that, the way to protect ourselves and each other is when we are out and we're outside, we should socially distance, physically distance, 6 feet. That is, and particularly being outside with the dispersion of droplets, because as the governor said, it's droplets spread person to person. And we know even just talking, we generate droplets. Up to 14 minutes, they can stay in the air in an inside environment. And when we look at singing, we know that a choir practice in Washington State infected 56 of 62 people from a person who was infected with other people. So if we wear masks, then we can reduce the amount of droplets that are generated, the dispersion of those droplets, the amount of time they stay in the air, and maybe even the amount of virus in the droplets, which protects people in our environment. And that's the reason why it's so important for us to really consider wearing masks or face coverings. And if 80% of us do that, we will be able to open West Virginia predictably, safely. If 60% of us do that, we should be able to open West Virginia with some problems, but be able to get over that hump, just like we talked about with the flattening of the curve. And that's the reason why the governor is absolutely emphasizing that we should do this, and all the medical people are too, because it is a safe and effective way for us to continue to open and be protected. And that, therefore, we can then demonstrate to the rest of the country how to do that. But doing it intentionally, collaboratively, intentionally, and doing it because we care about each other and we care about our state is really a key. So thank you for that really important question.
Back into, and let me just say this, and I don't know that I hardly ever say this, if I ever have, but what an incredible, great answer. I mean, Dr. Marsh, what an answer, and I hope and pray that everyone heard this answer. He said, that Kenny, you delivered him a fastball right down the middle, but somebody's got to be able to hit it. And a lot of times fastballs just blow by a lot of us and everything. But what an incredible answer. Basically what he's saying to all of us is, if in fact a great amount of our population has this dreaded disease, they don't even know it. It's a blessing beyond belief because they aren't sick. That's great. And they'll get over it, and they may not have ever even known they've even had it. But what he's also saying is just this. If I knew that this thing was totally invisible, for the most part, now it's not totally, but I knew that a high percentage of it was invisible, then you have got to know that you've got to be really, really smart. If you're older, you just have to wear a mask. If you're absolutely older and you don't need to go and be in a crowd of people, or somebody can maybe run to the grocery store for you or whatever it may be, let's just be what West Virginians are over and over and over. Smart, 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 good people. Now, I want to tell you this, and I hope they're watching, but absolutely terrific friends of Kathy and I are Rodney and Lynn Weichel. I got a text this morning from Lynn. Now, they're a couple years older than me, but not much at all. And the text was, Jim, you're doing a great job, with handling this and everything, and you guys are all staying on top of it and everything else, but we're still being cautious in what we do. How could it be any better? How could it be any smarter than just that? And so that's what we need to do. We just need to listen to Dr. Marsh and do exactly what the Weichels are doing and do exactly what smart West Virginians are doing. And we're going to get through this. That's all there is to it. All of us know we've got to go back to work. We just can't sit on the porch and dwindle away. That's not going to work. But really and truly, if we'll just do what they're doing and do what Dr. Marsh said, what an answer. I would, again, tell everybody, wear your mask when you go outside. It doesn't seem like much of an inconvenience to me.
All right, thank you, Kenny. Next, we'll go to David Beard with the Dominion Post.
Hi. I have kind of an anecdotal question that's probably tied to Kenny's and to Dr. Marsh's answer. We say every day that this isn't over. We need to keep wearing our masks. Yesterday, we ended a week-long household quarantine. It wasn't tied to COVID. It was tied to a family member having surgery. But I went out to a strip mall to get some takeout food. And I was surprised to see that I was one of the few people wearing a mask. So I don't know if I was seeing an example of some quarantine burnout or some false overconfidence, but if that continues, how do you combat that and keep people focused on what's going on? Thanks.
Let me give a relatively short answer and everything and just say this, another good question, but how you combat it, first and foremost, we've got to watch the numbers. And if the numbers keep eking along in a good way and everything, you're probably okay. But from the standpoint of people, getting tired and a little coronavirus, just, I don't know, overkill or whatever it may be, not necessarily overkill, but just everybody just getting lax and tired and everything. I surely understand all that. I got it. And I've not been in the malls, but I drive by and I just observe people and I look and I keep telling people over and over and over to try to wear your mask, and especially wear your mask in an indoor facility, with other people that are, you can't have your social distancing and all that kind of stuff. But I see it too. And I see it, on television all over the place, pool party in some state where the 2,000 people all in the pool together, and standing around but absolutely, and I don't see them in masks, and I wish to goodness that more and more people would just be on guard and just be really smart, but we're going to continue to watch the numbers and hope and pray the numbers, continue to be good. And if they continue to be good, we'll be okay. But you're right. We need to not go sleep at the switch here because we still got a long ways to go.
All right, thanks, David. Next, we'll go to Annie Moore with WVVA. We may have some trouble getting Annie. Let's go to Charles Young with WV News. Charles, are you on?
Yes, sir. Hi, this is Charles Young with WV News. Governor, with the kind of expanded effort to test all of the inmates and all of the staff members at our correctional facilities, I was wondering if there was any consideration or plans to expand testing to the state's forensic hospitals. I know we had a healthcare worker at the Sharp Hospital pass away due to COVID. I believe it was at the end of March. Are those plans in the works of everything we're considering right now?
Charles, I'm sure the plans are in the works from the standpoint of our medical, experts and the work that they're doing. But Charles, I want everyone to understand just this, that we're not going to back off like, testing our daycare facilities or aggressively testing our minorities and everything in order to be able to go test our correctional facilities. We're not doing that. There's no way we're going to do that. And at the same time, I think Secretary Crouch may be able to shed some more light on this about Sharp, but anyway.
Yes, thank you, Governor. Thank you, Charles. It's a good question. We're actually in the midst right now of looking at our list of employees at Sharp. We're working with the local health department there, the Lewis County Health Department, and with Dr. Slimp and her staff. So the answer to the question is yes. As the governor mentioned yesterday, we're focused on trying to do more and more testing. We did 14,000 tests last week. So it's a little bit of juggling in terms of making sure we have all of the test components to do those in different areas of the state, and also to make sure we have enough contact tracers and individuals who can follow up on cases. So the answer to your question is they are on the list, and we're looking at that as well as all of the other testing we're doing. So.
All right, thank you, Charles. Governor, I'll turn it back to you.
Well, I don't have a whole lot. Again, I thank our president, for maybe intervening and reversing, some guidelines that were going in the wrong way, in my opinion, toward our great National Guard members and giving them some, breathing room to acquire some extra level of benefits, which I dearly, dearly think that they need to be able to have the right to, because the job they're doing and they've done has been spectacular beyond belief. I do want to end with just this. And you see on television all the time, but I have this map. We don't have it up on the screen right now and everything, but I have this map, and it shows all the states in the country and their death rates thus far. Well, we do have it up, and you'll see that the surrounding states around us. Now, just listen to these numbers just a second. Kentucky is 6 times the number of deaths that we have. Virginia is 20 times. Maryland and Ohio both are 30 times. And in addition to that, Pennsylvania is at 70 times the number of deaths we are in West Virginia. If you'll look closely at this, other than way, way up almost in Canada, I guess it's Vermont and Maine and everything, West Virginia, around all this massive population, has a number of deaths that are phenomenal. From east of the Mississippi River, it is unbelievable how what we have done as you, West Virginians, have done in this great state. You hear a lot of times about Florida, and Florida has a governor, and they're doing great work down there and everything else, and the media applauds them, and I do too, because they've done great, and they have a great governor down there, and he's doing great work, and all that's really, really good, except just one thing. And you just think about West Virginia. Florida has had 30 times the number of deaths that West Virginia has had. And look, if you would, just a second, who's the neighbors to Florida? It's the ocean. It's the ocean. I mean, for crying out loud, look at who's the neighbors to us. They've had 30 times the deaths that we've had, and yet look all around us at our neighbors and how many people that we have and how much exposure all of our border counties have. There's been a lot of good work that's been done here, but the primary work has always been done by you, West Virginia. So I can never, ever thank you enough. I can never, ever thank our president enough for all the crap that he has to wade through all the time, and yet he always is pushing buttons that are the best buttons to push for America, and he's been a real friend to West Virginia. So I would just say to you just this, as I've said many, many times before, please wear your mask. Please continue to be really, really smart. Use your brain in every way to protect yourself. If you protect yourself, you're protecting your neighbor and your loved ones as well. So just keep doing it, West Virginia. You're absolutely proven to be the miracle of the nation and everything, and there's so many opportunities that are going to come our way from the standpoint of your performance on this and many other things. But really and truly, as the world looks at West Virginia, they're going to look at our natural resources. They're going to look at our creativeness as far as our people, our innovation of our people. They're going to look at the safety. They're going to look at how great our teachers and our schools are. They're going to look at you, West Virginia, and say, that's a place I want to go. That's a place I want to go and visit. That's a place I want to go and live. That's a place I want to bring my business to and establish my business right there. So West Virginia, keep on doing it. You're doing great. Proud of you.